We are with the new topic with the interstitial cystitis or the bladder pain syndrome, BPS and IC. Right? We are starting from today. That is the renal symptoms and the sign regarding to the excretory system. Right? So the first topic, that is the interstitial cystitis or the bladder pain syndrome. Right? So let's see what are the objectives of the today's session. So after the completion of this session, you may know what are the definitions of the interstitial cystitis or the bladder pain syndrome, etiopathogenesis of the IC, what are the clinical presentation, which are the different investigations, which are the diagnostic evaluation, and what are the management, what are the complications and the prognosis. Right. So let's see our first objective, that is the definition. So definition of the interstitial cystitis. So it is also known as a bladder pain syndrome, and that is a chronic condition which is characterized by bladder related pain, pressure at the hypogastrium, bladder area, or any discomfort, right? And it is associated with the urinary urgency and the frequency, and in the absence of the identifiable infection or the other obvious pathology. So without any infection, without any pathology, when there is an urgency into the urination and increase the frequency, and there are the bladder related pain, that all conditions are called as a interstitial cystitis, right? So I hope you can easily understand what is the definition of the interstitial cystitis. uh, Other definition we will see. So this definition is given by the ESIC, European Society for the Study of the Interstitial Cystitis, ESIC. So interstitial cystitis is defined as a chronic pelvic pain, pressure or the discomfort perceived to be related to the urinary bladder, accompanied by at least one another urinary symptom, such as the persistent urge to void or the urinary frequency in the absence of the infection or other identifiable causes. Right? So these are the definition which is given by the European Society for the Study of Interstitial Cystitis, ESIC. Right? So this both definition are valid, and this is the easy for the understanding. Right? Now let's see the other objective. What is the etiopathogenesis of the interstitial cystitis? So there are the many etiopathogenesis. So let's see first one, that is the urothelial dysfunction. Second one, that is the neurogenic inflammation. Third one, autoimmune. Fourth one, infection hypothesis. Fifth one, psychogenic and the central sensitivity. And the sixth one, that is the genetic predisposition. So let's see first one, urothelial dysfunction. So damage or the deficiency in the glycosaminoglycan, that is called as a GAG, layer of the bladder mucosa. So in the bladder, the inner mucosa have one layer of the glycosaminoglycan, that is called as a GAG. So उसके अंदर कोई डैमेज हुआ है या उसकी डेफिशिएंसी है बाय बोन, राइट? सो उसकी होने की वजह से क्या होता है, दैट अलाउज द यूरिनरी सॉल्यूट like a potassium to penetrate and the irritate the bladder wall. So वो जो gag layer है वो protect करेगा bladder wall को penetration by the different urinary solute like a common, that is the potassium. So potassium urine में जो निकलता है तो वो gag layer उसको penetrate करने से बचाता है. Second etiology, that is the neurogenic inflammation. So that is the upregulation of the pain pathway. राइट? सो पेन पाथवे आप सबको पता है. सो उसके अंदर अप रेगुलेशन हुआ है. सो इंक्रीज द नर्व ग्रोथ फैक्टर एनजीएफ एंड द मास्ट सेल एक्टिवेशन होने की वजह से ब्लेडर की जो वॉल है वो इरिटेशन होती है. थर्ड इटियोपैथोजेनेसिस, दैट इज द ऑटो इम्यूनिटी. So presence of the autoantibodies and the coexistence with the other autoimmune disease, the commonest autoimmune disease, that is the Sjogren syndrome. So in the Sjogren syndrome, the autoantibody which can causes the irritation of the bladder wall without the presence of any infection, right? So other, that is the fourth one, etiology, that is the infection hypothesis. So sometime the previous bladder infection, if there is a bacterial cystitis is there, and after the infection, it may trigger persistent immune response and which can irritate the bladder wall, right? Fifth one, that is the psychogenic and the central sensitization. So due to the stress and a depression, anxiety, these three psychogenic conditions which amplify the symptoms, and it is a link to the other pain syndrome like a fibromyalgia and the irritable bowel syndrome. उसकी वजह से भी central sensitization होने की वजह से भी क्या होता है, bladder wall irritation रहती है, frequency of the urine will be increase and the urge of the urination will be also increase, right? Sixth one, that is the last, genetic predisposition. So sometimes family history may play a minor role, not a major role, but the minor role. Family history में जो कोई ब्लीडर इन्फेक्शन का प्रॉब्लम रहता है तो माइनर रोल इसका दिखाया जाता है. So I hope you can easily understand what are the different etiologies of the interstitial cystitis or the bladder pain syndrome. Right now, let's see what are the different clinical presentation which are present into the IC or the BPS. So first, symptoms are the chronic and the lasting more than the 6th week. So bladder pain syndrome, always there will be a chronic, and the symptoms including like a bladder pain or the discomfort. So worsen with the bladder filling, and the symptoms is relieved by the voiding. Urination हो जाएगा तो patient को अच्छा लगेगा. Second one, that is the urinary frequency, often more than 8 times per day. There will be a nocturia, means night, रात को भी बहुत बार जागना पड़ता है यूरिन पास करने के लिए. अर्जेंसी, स्ट्रॉन्ग नीड टू द यूरिनेट, बहुत स्पीड में जाना पड़ेगा. डिस्पेरेनिया, डिस्पेरेनिया means the pain during the intercourse, which is again regarding to the bladder pain syndrome. Patient feeling the suprapubic pressure at the bladder area, the hypogastrium, and same. एक बात आपको खास ध्यान रखना है, एब्सेंस ऑफ द इंफेक्शन. सो एब्सेंस ऑफ द इंफेक्शन ये जब सिम्टम होता है, सो वी कैन कंसिडर दैट इज द बीपीएस और द आईसी, right? So absence of the infection, when we do the repeated sterile urine culture and the culture are the negative or the sterile, right? So symptoms are the fluctuate and may worsen with the certain triggers like into the stress, when change the diet, and at the time of the menstruation the symptoms are the fluctuated, right? So these are the clinical features of the interstitial cystitis or the bladder pain syndrome, right? So I hope you can easily understand what are the. एक बात सिर्फ याद रखनी है कि सारे सिम्टम लगते हैं यूटीआई जैसे, फ्रीक्वेंसी बढ़ जाएगी, नॉक्चूरिया हो जाएगा, अर्जेंसी बढ़ जाएगी, ब्लेडर में पेन होगा, बट इन्फेक्शन नहीं होगा. सो उसको हम लोग कह सकते हैं इंटरस्टिशियल सिस्टाइटिस. Right now, let's see what are the investigations which we have to perform to diagnose the BPS. So first we have to do the urine analysis and the urine culture. So this is the essential step to rule out the infection. So rule out the UTI, right? Second one, that is the post-void residual volume, right? So we can perform the USC, and after the urination, how much urine which is present into the bladder. So to exclude the voiding dysfunctions, माने हम obstruction कोई भी होता है उसको हम rule out कर सकते हैं. Third one, that is the cystoscopy with the hydrodistension. So this is the rare, but it is a perform under the anesthesia. Anesthesia के अंदर में करना पड़ेगा. And आप जब cystoscopy करेंगे, so scope मान देखना, तो पानी पहले उसको हाइड्रो डिस्टेंशन करते हैं, ब्लेडर को फुल करते हैं, बाद में सिस्टोस्कोपी करते हैं. सो हमें वहां पे ग्लोमेरुले ट्यून्स मींस द पिन पॉइंट हेमरेज इज फाउंड ऑन द ब्लेडर वॉल दिखाई देंगे. और सेकंड वन, दैट इज द हनर्स लेसन. सो दैट इज द क्लासिक अल्सरेशन इज प्रेजेंट. So classic ulceration, ulcer दिखाई देंगे Hunner's lesion में. So this is the two sign which we found into the cystoscopy, but it is done into the rare. Third one, fourth one investigation, that is the potassium sensitivity test, because when there is a gag layer is a damage, so we have to set the potassium sensitivity. So pain response to the intravesicular potassium chloride देंगे, so उसमें pain बढ़ता है. So we have easily identify, so the patient have a interstitial cystitis and the damage of the gag layer, right? Another, that is the urodynamic studies, so to rule out the detrusors overactivity or the other voiding disorders. So हमें urodynamic studies करना है. And the pelvic ultrasound and the MRI to rule out the any anatomical abnormalities. So these are the different investigations which we have to perform to rule out what may be a cause of the interstitial cystitis, right? Now let's see what are the diagnostic evaluation criteria. So first criteria, that is the chronic bladder pain more than 6 weeks, but mandatory without infection. Second one, absence of the obvious causes like a stone नहीं होना चाहिए, malignancy नहीं होनी चाहिए, UTI नहीं होना चाहिए, तो हम उसको IC और the BPS consider कर सकते हैं, right? Or there may be a confirm with the bladder diaries. We have to make one diary, and at same time patient will be recorded the every voiding. So frequency कितनी बार आई, volume कितना आया, so वो bladder diary से हमें पता चलेगा. Sometimes we have put the O'Leary sent questionnaire, that is the specific questionnaire for the IC. So it is for the symptom score, right? And for Hunner's ulcer, we have to perform the cystoscopy. ये तीनों में जो हमें कंफर्म रहता है, और साथ में स्टोन नहीं है, मेलिग्नेंसी नहीं है, और इन्फेक्शन नहीं है, और पेन मोर देन 6 वीक है, देन वी कैन कंसिडर the patient is suffering from the interstitial cystitis. Right, now let's see what are the management of these cases. So main there are the 4 management, but remember there is a no definitive cure, and we have to do the multimodal and the individualized approach to treat the interstitial cystitis. So first, that is the lifestyle and the behavioral therapy. Second, some oral medication. And third, that is the intravesical therapy. And the fourth, that are the surgical options. Right. So let's see first one, that is the lifestyle and the behavioral therapy. So for that, you have to advise your patient to avoid the bladder irritants like caffeine, citrate fruit, or the alcohol. And we can give the bladder training. Bladder training कैसे देता है? So when the patient is doing the urination, so we have to suggest the patient stop for the few seconds the urine, and then again we have to start the urination. This is the bladder training. And we have to do some CBT for the stress reduction technique, and we have to take the help from our physiotherapy friend. We have to advise for the pelvic floor physiotherapy for the bladder pain syndrome, right? So these are simple advice. We can say that is the regimen we can give that as a lifestyle and the behavioral therapy. Now let's see what are the different oral medications which are useful to treat the IC. So first thing, that is the amitriptyline medicine, that is the tricyclic antidepressant for the pain and the urgency we can give for the few time. Another, we can give the pentosan polysulfate sodium PPS when we do the cystoscopy and found the ulcer uh, or the pinpoint hemorrhages, then that is the confirm that is the damage of the gag layer. So that pentosan polysulfate sodium is useful to restore the gag layers. We can give the antihistamines like hydroxyzine for the mast cell stabilization, and other for the pain and the spasmodic pain we can give the analgesics and the antispasmodic. So these are the oral medications which are useful to treat the interstitial cystitis. Other part of the treatment, that is the intravesical therapy. So in the intravesical therapy, we have to direct bladder instillation. Bladder के अंदर ही medicine देना है. We can give the heparin also. We can give the lidocaine or the DMSO, dimethyl sulfoxide. We can give, and this may be useful when the oral medications are not work properly, right? And the last option for the treatment, that is the surgical option. So in the Hunner's lesion, when there are the ulcer, we have to do the transurethral fulguration. वो हम सर्जिकल एक ऑप्शन ले सकते हैं, और द ब्लेडर ऑगमेंटेशन, हम ब्लेडर को ऑगमेंट कर सकते हैं, और सिस्टेक्टोमी, वेरी रेयर है कि ब्लेडर निकाल देना पड़े, तो वो रेयर कंडीशन में हम ब्लेडर को निकाल के डायरेक्ट बाईपास यूरिन का कर सकते हैं. दिस आर द सर्जिकल ऑप्शन व्हेन द ऑल अदर multi medical treatment and the rural and the physical every medications when fail, then we have to only option to do the surgical intervention. Right now, let's see what are the complications of the interstitial cystitis. So first, there is a chronic pelvic pain is there, and it reduces the quality of life. There will be a depression and anxiety. Due to the bladder pain syndrome, there is a sexual dysfunction like premature ejaculation or the pain for pain at the time of the intercourse. Due to the nocturia, there will be a sleep disturbance, and when without any infection, and even give the antibiotics, so to rule out without any infection, so risk of the over treatment or the unnecessary antibiotics, so the complications may be very poor, right? And now let's see the last objective, that is the progressive prognosis. So that is the variable and the unpredictable course, कितना लंबा चलेगा पता नहीं, और क्या ट्रीटमेंट का आएगा वो भी पता नहीं है. Some patients are experience remission, फिर से आ जाएगा. Other have a persistent, किसी को लंबा चलेगा, और some have a progressive symptoms के अच्छा लगता है. Sometimes the long term management often required, कि long term management करना पड़ेगा. And for the treatment, that is the early diagnosis and the multimodal treatment is a improve of the outcomes of the interstitial cystitis. So friends, I hope you can easily understand what are the different objectives of the today's session, interstitial cystitis. So after a few time we have met with the another topic regarding to the renal system. सो फॉर दैट अब तक, यहाँ तक. थैंक यू वेरी मच. So once again, thank you very much. Stay tuned, and if you have any difficulty, you can ask me or you can comment. Once again, thank you very much.